When I first came in contact with this opioid crisis, I was working for the New York City Administration of Children's Services, child abuse investigator. And I got an assignment to go to a hospital in the Bronx. And I had to go to an emergency ward where children were just being born. And it was an ICU unit for babies that were addicted and premature. And as I walked in there, I seen a baby that was about the size of my hand. And the baby was shaking, and the baby was addicted to opioids. It was an image that was put in my mind, and my brain burned, etched in there, that I'll never forget. It was one of the longest rides back to my office that I've ever had. And that day changed me in the way that I looked at the whole entire human situation when it comes down to trying to improve our community and the people at large. It was at this very time that I knew for a fact that the Americans and the children had a very serious condition. They were helpless and they were hooked on opioid. I stayed doing child abuse investigations for more than 10 years. Transferred over to Nassau County Foster Care Division, and I found the situation very, very, very interesting. A lot of grandparents had to step up actually and take control of their grandkids in court cases. A lot of it due to opioid abuse and addiction. Seeing a child going through those kinds of addictions and having withdrawal symptoms is moving, to say it at best. And still even today, in the United States in 2016, healthcare providers across the United States have wrote and written more than 214 million prescriptions for opioids and pain medication. That is a rate of 66 people per 100 people. And drug overdoses claimed the lives of nearly 64,000 Americans in 2016. Nearly two-thirds of these deaths, 66% of them, involve a prescription or illicit opioid drug. And more than 40% of the U.S. opioid overdose deaths in 2016 involve a prescription opioids. A lot of this is coming from our medical systems, and our medical teams in our hospitals, and how these prescriptions are just being rolled out one after another, and it's almost like they really just don't care. When I went to go work in the oil sands in Canada, a lot of the things I did around the safety situation was the same. I found out the opioid situation was exploding in the oil sands when you're living over there on the camps. And I found out that the opioid crisis is growing in Canada, driven by both the illegal and prescription opioid use. Fentanyl was a big one and appears to be fueling the rise of opioid-related deaths. The crisis is having a devastating impact on the health and lives of Canadians, their families, communities across the whole entire country. In 2016 alone, in Canada, there was 2,861 opioid-related deaths and 16 opioid-related hospitalizations every single day. While the opioid crisis has affected every region of the country, Western Canada, British Columbia, and Alberta, and the Northern Territories, such as the Yukon, Northern Territories way up north, have experienced the highest burden. And nationally, most apparent opioid-related deaths occur among males, 74%, individuals between the ages of 30 and 39 years of age, accounting for the greatest portion of the 28% of the whole entire population of Canadians. Now remember, Canada only has 32 million people as a whole entire population in the whole entire country. And so the evidence reveals that the crisis is not restricted to just opioids. 82% of apparent opioid-related deaths from January 2016 to June 2017 also involved one or more non-opioid substances. It is a very, very, very difficult thing to combat. A very, very, very horrible situation that we're facing. And our children are receiving the brunt of it because a child in the womb does not have a choice whether or not they're going to be addicted to something or not. So if you know someone in pain, encourage them to talk to their physician, a PT, a counselor, about safely managing their pains and safer ways of managing their pain. It's extremely important for us to bring this awareness out into the forefront so that we as North Americans, and that includes Mexico, will be able to deal with this thing out front and save thousands and thousands, if not millions, of babies' lives from going through that painful withdrawing and having the parents not suffer that guilt and putting their poor little innocent babies in that type of position. My time in the child welfare system and doing all these investigations have taught me a lot. And this is the reason why I look at children as such a precious commodity and look at human beings precious as well. So we're coming to find that there's an extreme need for us to constantly talk about the individual and them being able to understand who and what they are as beings and being able to get them integrated into a co-community development program so that they can be able to get the help that they need, get the healing that this crisis and the things that I'm seeing out here in saying. If you are a social worker, doctor, psychologist, please contact me, write some notes, and let us begin the process of integrating you as well into these new co-creation communities so that we can administer the healings to them. Take time to take care of yourselves. This is Ronnie McLean for Dark Matter Radio.